Hi everyone, my name is Danielle and I'm in the personal fitness training program and at NATE, and this is my video I'm going to be making for cueing and demonstrating movement patterns. I'm here set up in my basement, and I set up my new bike in the background for you guys to have something nice to look at. I'm really excited about it, so I thought I'd show it off. I just got it this year and I'm racing in about a month on it, so I'm pretty excited. If we get back to the video about what we're going to be talking about, so we'll talk about different joints and planes of motion that they occur in. So I'll talk about what a plane of motion is first, just so you guys have an idea. So we have the sagittal plane, which divides our bodies into right and left halves. So you can think about it as a line going straight down our bodies. A typical movement would be a bicep curl, so you would use flexion on the way up and extension on the way down. And the next one we have is the frontal plane, so it divides our bodies into anterior and posterior sides. And I remember this by, so it's called the frontal plane, and I think just about like your front side, so you have your front side and your back side, so that's that. And a typical movement would be a jumping jack, so you would use abduction on the way up and adduction on the way down. Next we have is the transverse plane, so it divides our bodies into superior and inferior halves, and this can be thought of when doing rotational movements such as like the Russian twist. So if you'd be sitting on your bum and then you would just be working your abs. That's an ab exercise if you're not familiar with it. Or you can use forearm supination or pronation. Another tip is that the transverse plane is also known as the horizontal or axial plane. So last but not least, we have the diagonal plane. It's just known as combining two or more of the planes that I just mentioned. So it's just a mixture of them all, and it's called the diagonal plane. So a typical movement would be swinging a golf club. So you would come across, and that would be called your diagonal plane. So next up, we're going to talk about the movements in the glenohumeral joint. So we have, I think, 4 of them that our teacher set out for us to talk about. So we have the glenohumeral joint. So this one is going to be in the frontal plane. So we would use abduction on the way up and adduction on the way down. And again, abduction and adduction. So now I have the sagittal plane. This one we can use flexion and extension. So we'd have arms out by your sides, and we would use flexion and extension, and flexion and extension. And again, for this one, for this movement, if you're interested in learning about hyperextension, it's just past the midpoint. So this is hyperextension, so you would normally come up to flex and down to extend. So that would be your normal range of motion, and then you would just hyperextend back. So that's what that is. Now we have internal and external rotation using the transverse plane. So our humerus is held vertically, and we would use we would rotate our antebrachial laterally for external rotation, and towards the midline for internal rotation. Now the last exercise for the glenohumeral joint we have is using the diagonal plane. So the humerus is across the body, and we would use abduction to raise superiorly, and then we would use adduction to raise to lower inferiorly. So again, abduction, and adduction. Now, so if we want to talk about the lumbar spine, this one we'll be talking about the frontal plane. So using lateral movements, so side to side. So we would use flexion on the way down laterally, and then extension on the way back up. And again, flexion and extension of the lumbar spine. And next one we have also using flexion and extension, but this time in the sagittal plane. So we would lay down. You can also do this standing up, but I'll use it laying down because I like this exercise better laying down. So we would use extension on the way up and flexion on the way down. And flexion and extension. So this one's great for strengthening the back muscles. I definitely use this one a lot personally. The next one we have is in the transverse plane. So remember, just anytime you're rotating your body. So this one you're going to rotate your thorax laterally, and then so we would use lumbar rotation to the right, and then to the left. So you can just rotate right across your body, and then so we would rotate to also make our thorax line up with our iliac crest. So that's another way to think about it. That's it for the lumbar spine. So now if we have the shoulder girdle that we're talking about, so this one's in the transverse plane. An exercise would be to protract and retract your scapula. So we would protract, and then we would retract the scapula. So protract and retract. Next we have in the frontal plane, these are moments using elevation and depression. This one I memorized by, so elevation, depression, so my little symbol for it is the I don't know. So when you say I don't know, you usually raise your shoulders up, which is you elevating them, and using depression on the way down. So again, elevation and depression. Now for the sagittal plane, so using upward rotation of the scapula is what this is called. So have your arms out in front, and we would use upward rotation of the scapula. So you'd raise your hands up towards your cranial region and back down inferiorly. So again, upward rotation of the scapula and back down. That's it for the shoulder girdle. Now if we want to talk about the knee joints, everyone loves the knees. So if we talk about flexion and extension, so flexion is making the joint angle decrease. So if we want to, I'll stand to the side so you can see, and we would raise our calcaneus up to our gluteus. So flexion and extension on the way down, and again, flexion and extension. And the next one we'll talk about is internal and external rotation at the knee. So if the knee is at 90 degrees, we would use external rotation and internal rotation. And again, external rotation and internal rotation. So that's a short one for the knees. Next one, we're going to talk about the hip joints. Everyone loves the hips, and for the sagittal plane, some movements I'm going to talk about. So we would bring the femur up with a straight leg superiorly towards the pelvis, and then inferiorly back down. And straight leg superiorly and inferiorly. Now for the frontal plane, using abduction and adduction of the hip, we would bring our femur laterally away from the midline, and so we would use abduction and adduction on the way back towards the midline. So again, abduction and adduction. That one's great for working on your balance too. Now for the transverse plane, so you would use internal and external rotation. So you would bring the knee, I already mentioned one of these exercises, but you would bring the knee to 90, and you would just rotate laterally, and then back towards the midline. Lastly, for the diagonal plane, you would use abduction, so you would diagonally point your foot towards out the side, and you would use flexion, or you would use abduction, and then you would use adduction on the way back in. And again, abduction away from the body, and adduction. And that's it for my video. Hopefully you guys enjoyed watching it, and yeah, thanks for your time.